Is scoliosis curable? Whenever a patient receives a diagnosis of any condition, the first natural response is, what can they do to cure the problem? What can they do to get the problem better? And when patients receive a diagnosis of scoliosis, one of the most common questions they receive is scoliosis curable? Scoliosis is a structural condition. It is progressive and it affects the spine in many ways. It's progressive means that it's going to naturally worsen over time, especially if it's left untreated. Unfortunately, scoliosis cannot be cured. However, scoliosis is highly treatable, especially as our conservative treatments have become more effective in treating progressive scoliosis over time. One common question I always get asked is, how does it actually get worse? Well, progressive scoliosis means that the unnatural sideways curvature of the spine with the rotation will increase this in size, meaning how large the curve is, and increase in rotation. And as these two things increase, they also increase the effect they're having on the body. The Cobb angle is the way you measure the size of curvature, and Cobb angle determines the severity of the condition, meaning mild, moderate, severe, or very severe. Mild scoliosis is when the Cobb angle is between 0 and 25 degrees, or 10 and 25 degrees, Moderate scoliosis is between 25 and 40 degrees. Severe scoliosis is 40 degrees plus. And very severe is when 80 degrees plus is a category I like to use for something I call very severe cases. Unfortunately, mild cases can progress to moderate to severe, and so on. So we know scoliosis does progress over time. The most common type of scoliosis is something called idiopathic. There are very different types of scoliosis, but idiopathic cases are the most common. This is for like 80% of all known diagnosed cases. The most common diagnosis of idiopathic scoliosis is in the adolescent age, and this is between the ages of 10 and 18 years of age. The remaining 20% of cases of scoliosis are diagnosed with a known cause. Neuromuscular scoliosis is when a patient has a neuromuscular condition, and they also develop scoliosis. This is like Ehlers-Danlos syndrome, neurofibromatosis, cerebral palsy, things like this that can affect the connective tissue or nerve system of the body. Congenital scoliosis is when you're born with a bone in the spine that doesn't fully develop properly, and this congenital or hemivertebra can lead to a scoliosis developing at that site. Degenerative scoliosis, also something called de novo scoliosis, is normally adult onset, and it's normally a result of degenerative discs or degenerative bones in the spine, which can lead to curvature to occur in that area, most common lumbar area. And then the most common type is something called traumatic scoliosis, and that's when you receive a trauma to your spine or to your body, which causes a curve to occur, and the curve progresses from that moment. So when the condition occurs, it can progress. And the progression is normally a result of one or two things. In adolescence, the curves progress because of rapid growth. And in growth, the curves will increase directly related to how fast the patient will grow. So unfortunately, as a patient is growing during their adolescent stages, the curves can progress and get worsen. Unfortunately, once they move into the adult stage, the curve doesn't stop progressing. It continues to progress as a result of gravity. This gravity over time leads to slow progression during midlife, meaning very slow, a half a degree, a quarter degree, something a year between 20 and 40. Then as a patient ages and gravity accelerates the problem, and as the curve gets bigger, we tend to see an uptake in the rate of progression as patients get older, typically plus 50, 60 years of age, we tend to see an increase, and this is when the scoliosis tends to cause more problems or more symptoms. So it's mostly progressive in adolescent cases during growth, and in adults because of gravity over time. The underlying cause of the scoliosis is really an unknown factor, so therefore most treatment plans are addressing the curve as a structural condition. They're not necessarily addressing what caused the scoliosis. Meaning, if you already have a curvature and we say it's a neuromuscular condition like Ehlers-Danlos syndrome, and you developed the curve, and now you're 18, 19 years old, and you have a 30 or 40 degree curve, scoliosis. If there was some way of removing Ehlers-Danlos from your system, what caused it? Will the curve just completely correct itself? No, because now it's become structural. So even though if you identify what causes it and you correct what caused the curve, Normally, by the time most curves are diagnosed, the curve itself has become structural to the point where you have to deal with the curve on a structural basis. So all treatment for scoliosis must address the underlying structural component of scoliosis, meaning we have to reduce the curve, meaning treating the symptoms of the scoliosis are not necessarily going to produce a positive outcome for the scoliosis patient. However, what are these symptoms of scoliosis? Well, scoliosis in children and adolescents tends to be mostly a postural problem. We tend to see postural things as the main symptom of scoliosis in adolescents or children, meaning the first thing they're going to notice is uneven shoulders. They're going to notice some rib deformity or some rib differences. They're going to notice some waist differences, hip differences, maybe some changes in gait. Normally, kids do not have any type of pain when it's associated to scoliosis. If they have pain, it's normally very mild, and it's normally not severe. It normally tends to feel better when the patients are active, and it tends to go away. It's not constant debilitating pain. However, unfortunately, the opposite true is in adult forms. Adults, the number one symptom that brings up the diagnosis of scoliosis is pain. And it's because what's progressing the scoliosis during adult stage is gravity over time. Gravity is compressing the curve, which can compress the nerves, cause the discs to herniate, cause disc degeneration, bone degeneration, and this compression to the nerve tissue can lead to radiating pain, and this compression to the joints in an asymmetrical manner can lead to pain. So pain is the main symptom in the adult case. However, it's not the main symptom in adolescent cases. However, both patients can have changes to balance and coordination and gait. Also, it can affect digestive issues. It can lead to lung impairment in severe cases because the curves can get so big, they can get very stiff, and it becomes difficult for the patient to achieve full functional respiration. Even though it can affect lung impairment, we find that most lung impairment tends to be functional, meaning the patients don't have any day-to-day restrictions. They only will notice something if they go for high levels of functional lung impairment or lung abilities, because most patients don't lose 100% of their lung capacity just day to day to day. Here, how do we treat scoliosis in Scoliosis Reduction Center? We treat scoliosis very different, meaning we're just kind of just watching and waiting and seeing if the curve will worsen to the point where a patient needs surgery. Our conservative treatment approach is very proactive, and it's very proactive to try to deal with not only the curve from worsening over time, but actually physically reducing the curve during either rapid progressive phases in adolescent, before they reach adolescence, before they hit those phases, or even in adult or late stage adult. And the goal is one thing, is to reduce the size of curve. Because we know the smaller the curve that you have, the less likely your curve will progress over time. So keeping curves small is our number one priority. It's a very integrated treatment process, meaning that we have very different treatment based upon the specific type of scoliosis you have, where it's located, and the severity of the curve. And it's normally a combination of very structural rehabilitative chiropractic care, in-office therapy that are designed to help mobilize and reduce the curvature, customized prescribed home exercises, and corrective bracing. Based upon the size and the severity of the curve, these treatments are used as needed to deliver the very best results. Since we know scoliosis is a progressive condition, the curve that you're diagnosed with today, unfortunately, may not be the curve you have a year, 2 or 3 or 4 years from now. It's almost always indicated that the curve will be worse. We just don't know how fast the curve will worsen and how big the curve is worsening. So therefore, proactive treatment is always recommended. I always say the curve is never going to be smaller than it is right now without treatment, and you're never going to be younger than you are right now. And we know across the board, younger patients respond better to treatment, and smaller curves respond better to treatment. So when's the best time to treat scoliosis? As soon as you're ready to treat it, because the smaller your curve is and the younger you are, the better the results will be. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.